Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to do a job overview of an acute care nurse practitioner. Maybe you're a nursing student who's fixing to graduate with your registered nurse degree and you're thinking about the future and you're thinking about becoming an acute care nurse practitioner. Or you're currently a registered nurse who's thinking about going in this field. So in this video, I'm going to go over the following topics. I'm going to talk about what an acute care nurse practitioner is, what they do, which will include the tasks that they do. I'll also discuss educational requirements, salary, and general dislikes and likes about the profession. So what exactly is an acute care nurse practitioner? Well, an acute care nurse practitioner is an advanced practice registered nurse. So they were a registered nurse before they became an advanced practice nurse who has earned the credentials of a nurse practitioner through a program with a focus in acute care. There are different types of nurse practitioner programs. You have family nurse practitioner, adult nurse practitioner, pediatric nurse practitioner. So there's a lot of different programs that offer different types of specialties that you can go into. Now, whenever you're applying to these programs, the acute care nurse practitioner programs, they generally have two focuses that you can go into. First, you can go into Adult-Gerontology or Pediatric. And the Adult-Gerontology is working with the adult population to the geriatric population, and Pediatric, of course, is working with little children. And these people the ACNPs, acute nurse practitioners, they hold master's degrees or doctorate degrees. There is right now a huge push that eventually that all nurse practitioners will need a doctorate degree, but you can still obtain a master's degree. And where do they work? Well, acute care nurse practitioners, they tend to work in fast-paced settings with patients who are really sick. They're high acuity, they are critically ill, they're unstable, with life-threatening conditions that require high maintenance. So they're working with a lot of technology. These patients are on a lot of drips, ventilators, and it's a lot of stuff going on with this person. And majority of acute care nurse practitioners work in hospitals or acute care settings, such as the ICU, the ER, urgent care. And some tasks that they do includes they order and interpret test results, they recommend patient treatments, they prescribe therapy or medications under the supervision of a doctor, and they administer therapeutic procedures. So how do you become one? What are the educational requirements? First, like I said, you have to be a registered nurse. Then you can obtain a master's degree or doctorate degree, depending on what the program requires that you want, through a nurse practitioner program. You'll earn that through there. And you'll want to focus in acute care, and you'll want to pick either those Adult-Gerontology or the pediatric focus. And then after you graduate from your program, you'll pass a state board exam and become an acute care nurse practitioner. So how much can you expect to earn as an acute care nurse practitioner? According to BLS.gov, this is a compilation of all nurse practitioner salaries together, regardless of experience and what specialty they're in. And they earn generally about $47.11 an hour and $97,990 a year. Now, I wanted to see what exactly acute care nurse practitioners earn based on their specialty. So according to payscale.com, the average median salary, meaning everyone all together, regardless of experience, geographical locations, because where you live plays a huge role in how much you're going to make and what specialty you go into. So this is all together. They made an average of $91,188, and the highest earners who lived in New York made the most. But you have to remember, living in New York, they have a higher cost of living compared to someone who's living in North Carolina. So you always have to take that into fact. And the fields that paid the most was surgery, cardiology, intensive care units, and acute care settings. So let's talk about what they like about their job and what they don't like about their job. Because just with anything, you're going to like some things and you're not going to like some things. So let's talk about the positive first. Okay, generally people who go into this setting, they are adrenaline junkies. So they love high, fast-paced settings, and they thrive on this and they love it. Next, they love dealing with crisis situations, and actually they deal with that situation, and their treatment, what they prescribe for that patient, has actually helped them and saved their life. That is very satisfying to them, and they love that. Next, like I said, they love the environment. They love working with the technology that's literally at their fingertips, working with other disciplines, consulting with them, and they just love everything that's going on. They love the acute setting compared to like the primary care setting, which isn't as fast-paced as the acute care setting. What they don't like. Now, acute care nurse practitioner, the job is stressful because you're dealing with life and death situations. So there is a risk for burnout because you're having constant stress on you, and you're dealing and you're seeing death a lot. So that can tend to burn you out, especially if you don't take care of yourself and take breaks. Next, it wears on you as you start to age. A lot of people report that, you know, this was good whenever I was in my late 20s, but now that I'm in my 50s, I'm a little bit tired and this is really wearing me out. So the fast-paced stuff, as you get older, it starts to wear you out, and you want to settle more for a lower pace setting. And then next, last but not least, there is a lot of responsibility and liability. ICU is very high stress if you work there. A lot of lawsuits happen in that area, so you have to always be on your game. There's a lot on you, and people are really going to you for the answers, and you have to make sure you know what you're doing. You have a lot of responsibility and liability. So that's another thing that people report that it's a little bit of a dislike. So that is about acute care nurse practitioners. I hope that helped increase your knowledge and let you decide maybe if you want to enter the field or not. And please check out our other YouTube videos on nursing specialties. And thank you so much for watching, and please subscribe to this YouTube channel.